If you have ever had a medical question late at night and you wish you had someone that you could call and get an answer from, well, you are not alone. The good thing is that now, thanks to efforts at CHI Memorial, if you have a cancer-related question, they have a way to help you now 24/7. Kim Shank joins us this morning. She is with CHI Memorial's Rees Skillern Cancer Institute. So good to see you.
Thank you.
This makes so much sense. You're calling this program Cancer Connect.
Yes.
And what makes such logical sense to me is that I would think if you have a cancer diagnosis, probably you have a lot of sleepless nights in the very beginning stages, especially where you and your family are questioning everything out there, and you don't want to wait until 9 o'clock the next morning sometimes to get an answer.
That's exactly right. That new diagnosis of cancer brings on a lot of questions, a lot of unknowns, anxiety, and we wanted to be able to provide a resource for people that could address those questions, concerns, those unknowns 24/7 to get people the help that they need.
Within the memorial practice, you have, thankfully, so many specialties that
Yes.
our viewers are used to hearing focused on. But at Rees Skillern, this is where a general oncology practice can come into such advantage, because no matter the cancer you're diagnosed with, there will be a way for you to get an answer by calling that number.
That's exactly right. We have specialists, we have clinical support staff that is well trained and versed in all types of cancer. So we are very fortunate to have that.
So how does it work exactly when someone calls the number, and of course it's local? Are you really getting a person on the other end of the phone?
You absolutely are, and that was one of the things that was a high priority for us. So you are getting a person, a live person, that has been trained, thoroughly trained in oncology services here at CHI Memorial. At that point, the person answering the phone will give you the information you're needing, or if it requires a more clinical aspect, they will route that caller to the appropriate clinical resource to answer questions, concerns, and connect with resources. If someone's calling, late at night, after hours, holidays, things like that, the same thing. They are going to get a live person that will be able to give them some general information and then connect them with the appropriate clinical resource at the next business day. But they will get the initial information that they need right then.
There are some buzzwords, some specific vocabulary words that are used in your line of work, and so people hear them mentioned often, but until it touches your life, you don't realize the real power behind the word. And one of the words that you focus on a lot at Memorial is comprehensive. Explain what makes this comprehensive approach so beneficial for people.
Yeah, so we know that a cancer diagnosis affects the whole person, body, mind, and spirit, and the entire family. It's not just that person's diagnosis. So our comprehensive approach here includes physicians, medical oncologists, radiation oncologists, surgical oncologists, pathologists, along with oncology certified nurses, oncology certified social workers, dietitians. We all collaborate together on the patient's care to meet all of their needs.
With HIPAA concerns, when someone comes in to your practice with any of your memorial locations, is it a good idea for them to put as many people on the list as if you wish, as possible? Because what if you're a daughter and you have a concern about your mother or father? You have to have access to hear and talk to someone, right?
That's exactly right. To get specific information, a patient has to list on the HIPAA forms or on some sort of document who we are allowed to share specific information with. So, it's really an individual decision, but yes, the more people that you allow us to talk to, the easier it might be for you if you're having a day you really feel poorly and you want someone to call on your behalf.
Okay, and very often at Memorial, you want your outreach to be available to people who aren't necessarily patients of one of your physicians. So does this Cancer Connect work in that way too? Can anyone call this number?
They certainly can. This is a community resource that anyone can call this number, and again, we will answer their questions. We will connect them with appropriate resources, appropriate community resources. So absolutely anybody can call this number.
All right, let me go ahead then and share the number with you. You'll want to write it down and keep it tucked away where it'll be easy for you to find. But of course, you can always go online as well. Kim, thank you so much for your time this morning.
Thank you, I appreciate it.
It is called Cancer Connect at CHI Memorial's Rees Skillern Cancer Institute. The phone number is an easy one, 423-495-2222. I mentioned the website, that's memorial.org/Cancer Connect, a 24/7 helpline for you. We're back after this.